United Methodist. Okay, I got interrupted. Oh.
It started the recording, so go ahead and start.
Welcome to the 50th South Carolina United Methodist Women Anniversary Year edition of Legislative Advocacy Days. My name is Linda Eichenbaum. I'm part of the Marion District, and I'm the South Carolina United Methodist Women's Social Action Coordinator. This is the final year of my term and our second Zoom legislative event. Welcome. To properly begin, we're always mindful that this is the day that the Lord has made. Let us rejoice and be glad in it. I pray that you have a lovely day in beautiful South Carolina and that the sun is shining in your beautiful part of the country as it is in mine. Permit me to introduce our 12 district social action coordinators: Patricia Armstrong from Columbia, Lori Feit from Greenville, Wendy Fleming from Marion District, Shirley Uge, Orangeburg, Edith James from Florence, Linda James from Rock Hill, Rebecca McDonald, Greenwood, Sharon McFalls, Spartanburg, Eartha Pinckney, Walterboro, Martha Sass, Charleston, Joyce Thomas from Hartsville, Carol Weatherford from Anderson, and our assigned Orangeburg District President, Barbara Simpson. We're also indebted to Registrar Rebecca Eleazar, our technical producers, Kim Love Quick, and United Methodist President, Kathy Ford, for their great assistance in this project. National UMW continues to focus upon two social priorities for this quadrennium: mass incarceration, criminalization of communities of color, with a particular focus on interrupting the school to prison pipeline campaign, and climate justice, with a particular focus on the Just Energy for All campaign. Both national campaigns are fully addressed with many resources at the www.unitedmethodistwomen.org website. It's a beautiful website, easy to access, great information. In addition to the national focus, our South Carolina District Social Action Coordinators have chosen to continue our attention to quality education for all of our children and expanded physical and mental health services access as legislative issues for 2022. Districts and units are always encouraged to identify and invest in their specific social action passions. Follow your passions. Our statewide action for the upcoming year will be predatory lending in all of its many forms, and we hope to present a number of avenues that districts and local units can take to help address these unjust practices. Our 4 Legislative Advocacy Day workshops are designed to address many of our special issues, and we appreciate speakers' generosity of knowledge, time, and spirit for our benefit. These workshops include public health issues such as overdose prevention, obesity, diabetes, and lifestyle patterns, predatory lending in South Carolina, including recent legislative victories and pending actions to halt these targeted and discriminatory practices, teen pregnancy prevention with parents and grandparents as primary sexuality educators, should be a very interesting workshop. And finally, kinship care programs through the Department of Social Services. This will introduce us to the benefits of alternative means to keep children within their familiar, comfortable, and safe worlds they already know. We hope that you'll be able to attend all 4 workshop sessions, that you'll complete the survey at the end of the series, and that you'll access the programs via the YouTube postings for further sharing with your units. By the way, 2021, our legislative workshops are already on YouTube, and they're really interesting. They're well done. We hope that the United Methodist Women are 8,000 strong in South Carolina. We can make a legislative difference for our most vulnerable citizens. As God's children who are charged to love one another, we are singular in seeking justice. To do so, we must educate ourselves, critically listen and learn, and then take appropriate action. As Christians, we believe that faith without works is dead, and we are very much alive, United Methodist Women. It is now my great honor to introduce our South Carolina UMW president, Mrs. Kathy Ford. Take it away.
Thank you, Linda. Good morning, everyone. Good morning to each of you, wherever you are this morning. I am Kathy Ford, your South Carolina Conference United Methodist Women President, and I thank you for joining us virtually today. We are gathered here together, not because it is Groundhog Day, although that can be a fun side issue to our time together, but rather to continue, to increase, to strengthen, to enrich our individual and collective response to social issues of concern, topics needing our attention. February is the month our nation focuses on our African American sisters and brothers, those found in history, those living with us today, and those who will be here in the future, days yet to come. We, South Carolina Conference United Methodist Women, recognize serious, large, powerful issues which sadly affect many lives daily in South Carolina. With sorrow, we find some citizens bear the burden of unjust issues and systems disproportionately to our other citizens. Our 4 February workshops will focus on the sick, the poor, the young, and those without family. Issues of health, wealth, family, and community will be examined. Together, we will listen, learn, and move forward in action and prayer. Together, we will build God's kingdom on earth, exercising faith over fear. Our theme for 2022, we will follow the path our Lord and Savior has walked. Our journey may be challenging and long, but it will not be lonely. We are fierce and bold and strong, ready to be inspired and sustained in learning and fellowship. I am excited to be part of the 2022 Legislative Advocacy Days event, designed and orchestrated by our Social Action Committee, chaired by Linda Eichenbaum. It has been a joy for me to witness the excitement, organization, and energy of our Social Action Committee and technology team as they prepared a way to share their news, inspire our minds, and engage our hearts with social justice issues disrupting so many South Carolina lives today. My hope is that your schedule will allow you to attend all 4 workshops. Each event is well planned with sincere presenters ready to educate and encourage your interest, to expand your knowledge with their topics of concern and expertise. Our closing prayer warriors will end each session by uniting our collective voices to God, seeking His will be done on earth as it is in heaven. Thank you for being part of our passion. Thank you for joining us today as together we do build God's kingdom on earth. And I am grateful to make this journey with each of you. Together we are exercising faith over fear. So please join me with a thumbs up and big smiles, ready to begin our 2022 Legislative Advocacy Days with workshop number 1.
Good morning. I'm Laurie Fight. I'm the Social Action Coordinator for the Greenville District, and it is my great honor to introduce our first speaker. This presentation will feature a Hold Out the Lifeline, a Mission to Families presentation by Program Coordinator and Diabetes Prevention Coach, Ava Dean. She'll share overdose prevention by practicing safe storage and disposal of medications and information, as well as the broader South Carolina health concerns, including diabetes and lifestyle patterns that impact other health conditions. I don't know about you, but this is extremely timely. I just cleaned out my bathroom cabinet, which I know is not where you're supposed to put medication, and found things that were at least 2 years old and way past expiration date. So I'm going to be taking good notes here. I hope you will too. Ava Dean currently works as a contract opportunity with Hold Out the Lifeline, which is a nonprofit, interfaith, and interagency collaborative. Prior to that, she served the community in roles at DHEC as statewide infrastructure coordinator, focusing on the statewide diabetes prevention program, the National Kidney Foundation, BCBS, and 12 years at Palmetto Health in the Office of Community Services, focusing on health education, promotion, and the county level diabetes prevention program. She received her Bachelor of Science in Nursing from Lander University, a Master of Leadership for Evangelism and Discipleship from Columbia International University, and her Master of Public Health from the University of South Carolina. In addition to her professional positions, she has been blessed to be married to Scotty Dean for 27 years and has 2 sons, Joshua, who is in the 11th grade, and Jonathan in the 6th grade. She says her desire is to serve, give back, and live as Christ's ambassador. Ava, we are so blessed to have you here this morning, and you may take it away. Ava, you need to unmute. You need to unmute.
I'm going to send you a request to unmute, Ava. Nope, you are not muted. So something on your computer has muted since you last left. Check your actual computer mute, your audio button on your bottom right corner. If you click like where your time is, did you mute your computer? It is completely muted. I'm going to mute you, and I want you to click the mute button to unmute after I do. Go ahead. Nope. Click the up arrow on your mute button at the bottom corner. And where it says test speaker and microphone. If you click there, after you do the sound test, it should have a speaker test. And it'll play your sound back for you if you can hear. And y'all, she was talking earlier. We've already tested this, so this just happened. So we appreciate your patience.
Can you hear me?
Yes, there you go.
Yay!
Okay. Don't know. Yes, we were talking clearly. So yes. Good morning, everyone. So yes, thank you so much, first of all, for the invitation to participate this morning. And Ms. Eickerbaum, thank you so much for reaching out to us and giving us the opportunity to participate in this. I really appreciate that. And I saw the agenda for this month, and it looks astounding on what you're going to be doing. And I'm very proud to be a part of this and this effort as we move forward. And Lori, thank you for the introduction as we move forward. I want to say, being on here beforehand, listening to the participants that's on here, I was born and raised in Pickens. So I heard Spartanburg and Anderson and all of that. Yes, I am very familiar with Greenville and all of that. So I know that. And also I am an intercessor. So I heard a request for prayer. So know that I will be lifting Michael up in prayer as well. So it's good to know that that we have that option and we talk about this. So I love to be able to do that as well. So to let you know that I'll be moving forward with that. So we are talking about South Carolina public health issues, but mainly focusing on diabetes and hypertension today. But do know there are so many things going on in South Carolina as we move forward with this. But the things you should know about diabetes and hypertension. And of course, as she said, we'll talk about safe medication storage and disposal as we close out here. Next. Now to share before I move forward, a little bit about Hold Out the Lifeline. Hold Out, we'll talk, first of all, we will talk what we will cover, who is Hold Out the Lifeline, what are South Carolina public health concerns, what is diabetes, and what is hypertension, opioid overdose prevention, again, safe medication storage and disposal. Next. Hold Out the Lifeline, we began in 1989. It's an interfaith and interagency collaborative, utilizes a lay health advocacy process at the state and local levels, assists faith-based organizations in improving the physical, mental, and social well-being of families in South Carolina, prepares consultation, technical assistance, education, and training. Next. Our mission statement, which I think is I'm biased a little bit, but what I think is awesome is to enable its partners and communities to address the holistic health of families in South Carolina. And we really believe that each one can reach one as we go out into the community. That's our desire to do that. Each one can reach one. Next. Now, as we move forward, to share a little bit, I wanted to share a little bit of statistics before we go into talking about hypertension and diabetes, but to look at what are the leading causes of death in South Carolina. Now, this was as of 2016, the data that I found with DHEC. You see that cancer was the leading cause, and heart disease was second. Up under that, unintentional injuries, chronic lower respiratory disease, stroke followed, Alzheimer's disease, diabetes, seventh, kidney disease, septicemia, and then suicide. So again, I highlighted heart disease and then diabetes. Those are the things that we will, even though hypertension, we'll talk about how that's actually linked to heart disease, but then diabetes at number 7. So those were the leading causes of death in South Carolina in 2016. Next. And to break that out a little bit, this was a chart that was printed out, years of potential life loss, selected causes of death. Now, this is a little bit different from to break it out due to premature deaths. And how do they determine that? They are described as deaths that occur before a person reaches the expected age of 75. So these are years potential loss is a cumulative measure based on the average years of a person would have lived if they had not have died prematurely. So again, you see that heart disease is right up there with, again, cancer, then the unintentional injuries, and then heart disease again is there, followed by suicide, and then the homicide right up under. Next. Now, South Carolina public health concerns. Heart disease. And I'm going to start out with this. Heart disease is a leading cause of death in the United States. South Carolina actually follows right behind it. It's the second leading cause of death here. How do we actually describe that? Because I want to say that there are so many things that fall up under heart disease, because when we hear that, there are actually conditions that fall up under that. So we have heart failure, heart valve disease, cardiomyopathy, pericardial disease, and then there are a few more that fall up under that broad topic of heart disease. And heart disease is a complication of two major concerns here in South Carolina, and the two that we're talking about are diabetes and hypertension. And before we move on, just to tell you how prevalent this is with heart disease, again, they put things up under this. And why this is so dear to me, I just recently had in December, my brother actually passed from, they labeled it as heart disease, but he passed from a massive heart attack. And my brother was 50 years old. And this was something that we dealt with, and he was not taking his medication the way that he was supposed to, but it is something that we had to deal with. And again, it was classified as heart disease. So yes, this is a South Carolina public health concern. It is a major issue that we are dealing with. So again, complications, two major complications that are falling up under this that we're looking at today is diabetes and hypertension. Next. Now, what's going on here in South Carolina? Diabetes. South Carolina had the 5th highest prevalence of diabetes among adults in the nation in 2017. 1 in 7 adults has diabetes, or approximately 500,000 adults in South Carolina. 1 in 4 over the age of 65 has diabetes in South Carolina. Hypertension, 1 in 3 South Carolinians have been told they have high blood pressure. And the reason why we say it like that is because this is self-reported. And 7 out of 10 people with diabetes have hypertension. So not only are they dealing with diabetes, but they're also dealing with hypertension. They have both. So that's 7 out of 10 of those have both of those that they're dealing with. Next. So we're going to start out with diabetes. We're talking about both, but we're going to start out with diabetes. Next. And when we look at diabetes here in South Carolina, 2017, approximately 31,000 hospitalizations and emergency department visits occurred in South Carolina for diabetes, and with charges of more than $567 million. The average annual medical expenditures by people with diabetes was $16,750 in 2017. And you see the source there, American Diabetes Association. And the cost of care for South Carolinian adults with diabetes is estimated at $5.89 billion in 2017. Since 2011, diabetes prevalence among adults has increased from 12.1 to 13.4 in 2017. And diagnosed prediabetes has increased from 6.7% in 2011 to 9.6% in 2017. And all this information is, I have a copy of that there, is on the Diabetes Impact. And that's an initiative with the Diabetes Initiative of South Carolina with DEAC. And it's out of MUSC. Excellent resource guide there that you can actually get this. It's on their website, that you go to the Diabetes Initiative of South Carolina, and you can find this handout there. It has the map that is broken down, but I wanted you to see that if you wanted to find this resource to get this data here. But as you see, this was in 2017, and this is the last data that DHAT has on there. But you can only imagine we're in 2022 now, and we'll probably be getting an update soon, but this is what we're seeing here. Next. Now, before we go on, a lot of you may know, and a lot of you may not know, what actually is diabetes. What happens and what occurs? Diabetes is a group of diseases marked by high levels of blood glucose. And you say, what is glucose? What happens with that? So it occurs when we eat food. So we put in food, we chew it, and the food that we have, it turns in actually glucose. So that's what that word glucose is the food that we eat. So the glucose goes in and it goes through our blood, and it gets to our cells. And the problem with what happens is when it gets to our cells, is the insulin, which is produced, and what I have here is pancreas, is the pancreas is the one that produces the insulin. And may not have known that, but that's the pancreas. I have the picture there. That's where the pancreas is at, right up under the liver there. It produces the insulin. And so you have your insulin. Insulin actually acts like a key. So it unlocks the cells to allow the glucose to get in. But if it's not functioning the way that it needs to, then the glucose doesn't get into your cells. Or if it's not utilizing it the way that it needs to, then you end up with too much glucose in your cells. So it's either not getting in properly, or it's either staying out in your cells. So that's what's going on with diabetes. Or you may not even have enough insulin to allow the glucose to get in your cells. So we're having the problems with all of these that are marked with problems with utilization of insulin, or maybe not enough production of insulin. Next. We have several types of diabetes. We have type 1. Body produces little or no insulin. It accounts for 5 to 10% of cases, usually diagnosed in children, teens, young adults less than 30 years old. And you must take insulin every day with type 1. And currently no one knows how to prevent type 1. Currently, we don't know. But type 2, the body doesn't produce sufficient insulin, or the body cells don't properly use the insulin. So difference is type 1, the body produces little or none, or no insulin, but type 2, the body doesn't produce sufficient insulin, or the body cells don't properly use the insulin. Remember I said the insulin was produced by the pancreas, and acts as a key to allow the glucose to get in. But if it's not working properly, then the glucose is not getting in the cells. With type 2, then it's not properly being utilized for that, and that's what's happening. In type 2, this actually accounts for 90 to 95% of people with diabetes have type 2. So, and then it develops over many years and is usually diagnosed in adults. But more and more children, and this is what I consider the sad, and this is why I've taught diabetes prevention for years, and this is why this is so dear for me. But more and more children are being diagnosed with type 2. And this is why I'm really focusing on prevention here. But more and more children are being diagnosed, and teens and young adults are being diagnosed with type 2. and genetic. It runs in families. We're finding out with type 2. Next. Other types of diabetes is gestational diabetes. This develops in pregnant women who have never had diabetes. And they typically find out when they do a certain tolerance test. Those of you that have been pregnant, I don't know if you remember or not, we have to drink that liquid, that blood sugar, that sugar liquid, and then they check your blood sugar just to make sure where you're at. Well, that was the tolerance test to make sure how the blood sugar, your cells was using the sugar that you got in. So that's exactly what that was. And then if it doesn't use the blood sugar properly, or if it wasn't processing it properly, then you get this diagnosis of gestational diabetes, and then you end up having to, may or may not have to take insulin. And it is something you have to watch your diet. And then I know women who have gestational diabetes and then afterwards don't even have diabetes. Don't know why this happened, but it's during the pregnancy that they do. Then there's prediabetes. Blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. So they're right in between, and we're ready to look at some levels. In the United States, 96 million adults, more than 1 in 3 have prediabetes, but more than 8 in 10 of them don't know they have it. And we're going to talk about that in a little bit. Next. Know your numbers with this. I don't know if you're getting your A1C checked, but I plead with you to make sure that you're getting it checked at least every 3 months. But know your numbers. A1C gives a 3-month snippet of your blood sugar level. And over here you see, what should your A1C? Normal is 5.7 or below. That is normal. Prediabetes is the 5.7 to 6.4. And for your diabetes is 6.5 or above. Now, if you're doing a fasting blood sugar, you may have that done. They may have you come in if you're getting your blood work done, and you may have that. So normal is 99 or below. Pre-diabetes is between 100 and 125. And then anything diabetic is considered the 126 or above. And then for your glucose tolerance test, that's what I was talking about, where you may have that done when you're pregnant, but they may have to do that in another case as well. It depends on your doctor, but those are the levels for that. 140 or below, 140 to 199, and it's considered pre-diabetic, and then 200 or above is considered diabetic. So know your numbers. Make sure you know your numbers. Now, risk factors for type 2 diabetes. Being overweight, having a family history, being physically inactive, and being 45 or older. Those are the risk factors. And what I don't have on there is race, African American, Pacific Islander, Latina or Hispanic, that can put you at risk as well. So I will share that my mother had diabetes. My mother passed when she was 62, and that was in 2009. My daddy has diabetes, and my cousin has diabetes. My aunt has diabetes. I do not have diabetes. But I do exercise. I exercise every day. I exercise 6 days a week. I am over 45. But so am I at risk? I just, I guess we can do this in the chat. Just tell me, am I at risk? After showing these risk factors, am I at risk? Just say yes or no, or just do a thumbs up. Am I at risk? I'm seeing thumbs. Seeing yeses and yes, yes. Mm-hmm. Yes, great. I saw some no's. Now let me tell you, and I guess I'm gonna say yes, I am. Let me tell you why. I am overweight. I'm working on it. I'm working on getting my weight off. I am overweight. I have a family history. I'm over 45 and I'm African American. I'm at risk. Now, even though I am working out, which is great, but I still meet, which is the race is not up there. I meet 4 of those categories. So I'm at a high risk of getting diabetes. So that's why I am doing my best to actually lose the weight now. And really trying to get this out because I know that I can't change my age. I can't change my race, but I can change my weight. So those, and I can't change my family history, but I can change the fact that I am overweight. So I'm changing the things that I can. So I can be active and I can lose weight and I can eat healthy. So those are the things that I'm working on now. So next slide. These are some map of diagnosed diabetes versus obesity among US adults. And this is between 2004 and 2019. I want you just to take a look at this. And it may be hard for you to understand, but just look at how it grew with obesity and diabetes. If you look at 2004, it was barely out there. Obesity, obesity is over to the left, like in the blue, and then over to the right is the color with the purple and the, I guess you could say maroon over there. But 2004, we had it, but not that much. 2009, starting to get out there. Also pay attention to over to the East Coast, Southern down, pay attention to that. Where we at? 2009 and then 2014, and look at 2019 and look at South Carolina. We are like almost purple, which is a combination of obesity and diabetes, combination of both. So we are almost completely purple there. We had a few of our counties in there that's not there, but we're almost purple. So this is a clear vision of where we have came from 2004 to 2019 now. And it just continues to, unless we get a hold on this, it just continues to get worse. So we have to do something about this. Next. Diabetes and health complications. I can't stress to you enough what diabetes do to your body. It affects your eyes, blindness. And let me just start with saying why. When you have an increase, remember I talked about how it acts like how the insulin acts like a key and allows the blood sugar to get into your cells. And if it's not able to get into the cells, it ends up in your blood and it just stays in the blood. Well, if it's in your blood and it doesn't have anywhere to go, where your cells, it can cause the damage, your arteries, and cause the damage to your arteries. So if you have blood sugar that's constantly in there, can damage the arteries to your eyes, damage to your eyes. I'm going to skip kidneys for a minute. I'm coming back to the kidneys. Same to your heart, with the heart diseases and stuff, the vessels to your heart, stroke, same vessels to your brain and everything. Loss of toes, feet, and legs. damage to the nerves. That's what happens with that. And I don't know if you know of anyone with diabetes who have had amputations. That's what diabetes do. That constant sugar in the bloodstream and causing the damage to the nerves. They get to the point to where they're unable to feel. Like the bottom of their feet. I know when my mom was alive, I used to go over to her house. That was my constant check. I had to check the bottom of her feet. I had to make sure that I could actually feel her. I would say, Mama, do you feel this? Do you feel this on your toes and stuff? Because before she passed, she actually couldn't even feel like the end of her toes and the bottom of her feet. So I had to check her toes. I had to make sure everything was okay because she lost feeling in the bottom of her feet. They sometimes lose feeling in their fingers as well. So they go to touch things and they like on the eye and stuff, they may not even feel that the stove is warm and stuff. So you have to make sure that you are watching them. I had my great grandmother and my grandmother who lost both of their legs due to diabetes. So lost her toes, feet, and legs. So yes, this is real. So going back to kidney failure, the diabetes, the sugar, the constant sugar, it causes damage to the small nephrons that are in your kidneys. And I could go on with another entire presentation with kidneys. I used to work at the Kidney Foundation, and that is another hour of presentation there. But it damages the nephrons that go to it's in your kidneys, and it will, yes, that is how it can cause kidney failure. So just know that you have to make sure that you're monitoring and monitoring your blood sugar level there. And one of the signs of diabetes, if you know, because if you have constant urination, you have to go to the bathroom all the time. Well, guess what's happening? You're trying to get that sugar out. It's trying to get out. And if it's trying to get out, but if it's constantly in there, it's destroying those nephrons that's in your kidneys. That's what's happening. So that's why that could be a cause, and the breakdown of those nephrons that are in there. So next. And I'll discuss how can we reverse that. What can we do? What can we do? Eat healthy. It's a healthy lifestyle. What can we do? We can exercise. We can lose weight, and we can manage our diabetes. And I think the question was, how can we reverse it? Let me see what that. How can you reverse? Okay, I'll talk about how can we reverse hypertension and diabetes. But eat healthy. We need to make sure that we are eating our vegetables and our fruits. And diabetes is tricky with fruits because of the sugar. So we have to make sure that we're monitoring that. But eat our vegetables. Exercise is 150 minutes per week. But if you're trying to lose weight, that goes up to 300 minutes. So we need to make sure that we're monitoring that. That actually goes up to 300 minutes. If you're not exercising at all, start out with 10 minutes. Break it up into 10-minute increments. Just move your body. Move your body. You will feel, I promise you will feel good. Just move your body. Get up and move. And I said lose weight if you need it. Sometimes you may not even need to. Let me make it clear. Everyone that is diabetic is not overweight. Everyone diabetic is not overweight. When I used to do screenings in the community, we had thin diabetic. Being overweight doesn't mean that you're diabetic. So just make sure that you are monitoring your diabetes. And again, managing. That may be with insulin. If you are diabetic, that may be with insulin, that may be with medicine, but managing your diabetes. Next. These are some resources, and I have them on there. You can actually get these from CDC, and I have them there, but I wanted to show them to you as well. These are excellent resources, just to let you know. And this is what they actually look like as well. And these, and the number actually, these just changed. And it's now for the United States, 37.3 million people have diabetes, and 1 in 5 of them don't know, and 96 million have prediabetes. But these actually just changed, but you can go on CDC and find this information as well. But this is a resource for you that you can get the same information and some of the things that I've shared today. So next. Now, talked about diabetes, and we talked about where we're at with that. Now, hypertension. Next. What is blood pressure? Because hypertension is one of those readings that I'm getting ready to show you. But first of all, I need to explain to you what is blood pressure. Some people don't even know what blood pressure is. Blood pressure, the pressure of blood, it is the pressure of blood pushing against the walls of your arteries. And arteries carry blood from your heart to other parts of your body. Next. Then you have your reading. So they take your blood pressure and they give you a reading, 120/75. So what is that? You have your systolic, which is your top number, and you have your diastolic, which is your bottom number. So systolic, it measures the pressure in your arteries when your heart beats. Top number. Diastolic measures when the heart rests and fills with oxygen and blood. So we have our top number, systolic, that's when it's beating, and then the diastolic is when your heart is at rest. So know that the top number is usually higher, and then the bottom number. So we have that. Next, yes. 2017, the American College of Cardiology and the American Heart Association published new guidelines for hypertension management and defined hypertension as a blood pressure at or above 130/80. Stage 2 hypertension is defined as the blood pressure at or above 140/90. So this is a chart here. Normal 120/80 or lower. Elevated is 120 above the 120, between 120 to 129 or greater than 180. Hypertension, and that's what we're talking about. Anything 130 to 139, stage 1, 120 to 139, 80 to 89. And then stage 2, greater than 140, greater than 90 on the bottom. So there's actually 2 stages of hypertension. You may or may not have known that, but they usually tell you that you just have hypertension. And that's what we're talking about, hypertension. So it's when your blood pressure is out of that normal range and when you go to get it checked or whatever. Next. This you may or may not have known. There's a proper way that you should have your blood pressure taken. So no food or drink for 30 minutes before you get your blood pressure taken. Now, if you can't do that, okay, but not have food or drink. But this one, empty your bladder. And I'm going to talk about why in a minute, but I can attest to that. Empty your bladder. I went to have my blood pressure taken, needed to use the restroom, and they took it. It was elevated. I know my numbers, and it was high. And I said, no, we need to check that again. But I went to the bathroom, and they took it again, and it was lower. But we're going to talk about in a minute why. But during the reading, no talking, and your arms should be at your chest height. Cuff against your bare skin. So I have this jacket on now. I would take this jacket off, make sure I take it off. And your back is supporting. So I would be sitting up in my chair like this, and then sit with your feet flat. Do not cross your legs. Do not cross your ankles. Do not cross any of this. And anyone taking your blood pressure should tell you this. So make sure your ankles are not crossed. make sure that you are sitting straight up and don't, you know how you go in the doctor's office, sometimes they be talking and you say, hey, how you doing? How's your family? Because you know them, maybe you're a primary care physician or whatever. You should not be talking at all, and they should know that. So you just sit there and you let them take your blood pressure until you finish, until they finish, and then you can talk to them. And then you go on. But no talking. And then you let them, and no, Miss Deborah, no talking. So let them just sit there and let them take your blood pressure. Because that can actually increase your blood pressure. So sit up and just sit there. And again, empty that bladder. Next. Again, now I want you to pay a close attention to something similar here. What's similar? Risk factors. Being overweight. Family history. Being physically inactive. Unhealthy diet. Did you see those before? Something, two that are different. Too much alcohol and tobacco use. Those are different, but those first four were in the same slide that we just talked about a while ago. So those are risk factors for hypertension. Yes. Next. Prevalence for hypertension. Prevalence for hypertension in 2017. This is what we look like. And again, look at South Carolina. Look at South Carolina. Oh my goodness, 32 to 38. Look at where we're at. So yes, we're up there in comparison to everyone else, adults 20 and older. And this is self-reported. So imagine people didn't report theirs. This is self-reported. Next. This is hypertension and health complications. What's going on with your hypertension? Remember, it was a blood sugar that was going through that was causing the damage to the vessels. What this is the pressure that is going through that's causing the damage. And you have pressure that damage the vessels. So same with your eyes. Same to the heart, and with the heart is less elastic to the arteries, so that's causing with your heart and stuff. Stroke, again, that messes with the vessels and stuff. And with your kidneys, I want to point this out. Your kidneys, you may or may not have known this, but your kidneys control your blood pressure. Your kidneys control your blood pressure. So remember what I was talking about when you needed to empty your bladder. If you got a full bladder, that it can actually affect your blood pressure. So your kidney controls your bladder. Control your blood pressure. Remember that. So it is so important that you take care of your kidneys. Take care of them. Please take care of them. Drink your water. Drink your water. So yes, hypertension is a health complication with having hypertension. They go hand in hand, diabetes and hypertension. Yes. Next. Eat healthy, exercise, lose weight. Similar things that I said. This one, manage your hypertension with medication if you have to take it. There is some, let me tell you, when I was in screenings and I saw this, you can be 110 pounds, you can exercise, you can do everything, but you can't change family history. And unfortunately, I've known people that do everything, but the fact that hypertension run in their families, they still ended up having to take medication. It was just a factor. So if you have to take medication for hypertension, you have to take it. Manage it. Make sure you're doing what you need to do. Next, and that's why we're leading into medication. So how do we safely store? So we've talked about diabetes. We have covered a lot with that. And let me just, I saw one on here. I'm not overweight. My A1C was 10.2. Let me make it clear. Being overweight doesn't have anything to do with your A1C. It does not have anything. Well, let me rephrase that. Let me back up. Overweight is a risk factor for having prediabetes and diabetes. Yes, it is. But you can remember it can be genetics. There are other factors that go into being a diabetic and your A1C. Are you exercising? Or it could be a family history. So I would have to say, what else are you doing? I have a friend that now I've been talking to her. She is not overweight. She is not, she's eating healthy, but she had not been exercising, and her A1C had been up. So I was telling her, but you're not exercising. You're not exercising. And she started exercising 30 minutes, 5 days a week, and her A1C went down. Her A1C went down. So we have to make sure that we are monitoring those things and doing the things that we need to do. But please let me make it clear that being overweight is not the key factor in your A1C being up. Okay? Safe medication storage and disposal. So we're talking about medication and handling that. So what do we know? Prescription drug misuse is a major public health problem in the United States and is at an epidemic level in South Carolina. Even though heroin, that's an opioid, is highly addictive, more people struggle with addiction to prescription pain relievers. Many young people who inject heroin report misuse of prescription opioids before starting to use heroin. So we're always talking about opioids. We're always talking about those other things that are with that, but they start with pain. They start with the pain relievers. They start with the prescription medication. 5 million painkiller prescriptions are filled every year in South Carolina. That is more than one for every person in our state. And 1 in 4 people who are prescribed opioids struggle with addiction. To prevent misuse of prescription medicine, safely store and dispose of unused, unwanted, or expired medication to limit this. That's our goal. We have to make sure that we are doing this. Next. So safe medication storage. First thing I want you to do, and this was discussed a little bit at the beginning. How do you do this? Safely store medication. Get organized. Check to see if you have any prescription medicines that are expired. So, and I think someone had done this had already done this. Great, you did what you needed to do. Check to see if you have any that are expired. If you do, let's separate them. Let's put them to the side. Let's go ahead and move them. And I brought a thing here. So you're going to check them and you're going to look at the date and all that stuff. And you're going to put them to the side. Secure your medicines. You're going to keep your medicines in a place out of reach of children and pets. And I like to put in here vulnerable adults, because you may have an adult that's having a problem with addiction. And please let me make it clear, it doesn't have to be an opioid. This could be just a regular pain medication, or it could be something else. So you have to make sure that you are checking to see that your medication's period, or keep your medicines in a place out of reach of children and pets. So also further secure any prescription narcotics like morphine, opioids, or codeine in a locked cabinet or drawer. So what I thought here was, let's just say that you had surgery, you had something, and you didn't take all your pain medicine. You have them, they're there, and you have them. So put them in a lock little case. This, I found you can get this at Walmart or something, and it actually has like a little lock here that you can use if you don't have it that much. Or if you have this, you can do this. And this actually goes in this, like this, that you can lock as well. Get you a bag to secure and lock. Or if you have something that sits as firm that you can lock, do that. But make sure that it's locked. So we're keeping those out of reach of your children, the vulnerable adults, and the pets. Do not share medication. Please, I can't stress this enough. Please don't share. Please don't share. You need to make sure that you are, if you have some medication and you have some left over, and aunt want to have some because she has surgery, please don't share, because you don't know what that medicine may cause an adverse effect. So please don't do that. Don't share your medication with anyone. So for storage, you're going to get organized. You're going to make sure that you put the ones that you're not using aside, and for the ones you're keeping, you're going to place those out of reach, and then you're going to secure the ones that you're keeping. Next. Safely dispose of the ones where any unused or expired prescription medicine should be disposed as soon as possible. Timely disposal of prescription medicines can reduce the risk of others taking the medication accidentally or misusing the medication intentionally. One option is to participate in a community take back drug day to dispose of unused or expired prescription medicine in designated locations in every state. And let me say, this is one way you can get involved. We'll do this twice a year. DEA offers this twice a year, April and October. We just had one in October. And if you, you can go on our website at holdoutthelifeline.org. We have them they're all over the state. And if you look on our website, you see where the locations are, and I'm going to talk about those. But the Take Back Day is offered twice a year. So you can participate by getting your church involved in this and getting your organization, sorority, fraternity involved in this. But get rid of those medications. Take them back. Get your church, making a movement of this and having your church participate in this. But this will help prevent overdose of people getting a hold of these medicines and stuff. So this is how you can get involved with this. So this is offered twice a year. Next. Another way is for you to participate in there's permanent drop boxes that are all across the state. And then on our website as well are the locations. So if we got them, they're all in the police departments, the sheriff's offices. We're working with 7 counties now. That's part of what I'm doing here. We have disposal options. So where you can actually go into the police department. They have the boxes there. We're charged with actually putting boxes in some of the police offices. We just put one in Greenville County. We just working on one here in Richland, but they already have them in the police departments and stuff. Some of your pharmacies like Walmart and stuff already have them. So take them to those places and dispose of them there. So you can do this. So this is located at multiple places, but you go on our site, you click on one of these sites, you can actually put in your zip code and you will have it has it there that you can, it tells you the closest place. You put like within 10 miles, within 20 miles, within 150 miles, and you can actually take your medication there. So if someone has actually already cleaned out their medicine cabinet and you have all that medication there, then bag them up and just take them there and get rid of them, and then you're good. Take them to your local sheriff's office, police department, and just get rid of them that way. Next. And third option is if you can't make it out of the house and you just transportation wise, or you just physically can't make it out of the house. We like to give this option. You can follow these simple steps. You're going to mix your medicine with a liquid or pills. Do not crush them. Do not crush your tablets or capsules. And then you're going to mix them with an unimpelling option. So I would put it in this bag, and then I would take my medicine, and I would These would be my expired or the ones that I'm not using or anything like that. And then I would just pour them in this bag. And then I would mix them with dirt, cat litter, or any coffee grounds, but it's to make it unappealing as possible. And then I would place this mixture in my container like this, and then I would seal it in my plastic bag, seal it. And then I can throw this in my trash, but not to throw just the pills themselves. And to be honest, y'all, before I knew about this, I was just emptying them in the trash. No, don't do that. Just put them in a bag like this. Put your dirt, your cat litter, whatever it is in here. Put them in a plastic bag like this, and just put this in the trash. If you're gonna do it this way, throw this away. Then I'm gonna take my bottle that has my information on it, and then I'm gonna mark my personal information out on my bottle. I'm gonna get rid of all my information on my bottle so no one knows my information. Or if you do like I do, just pull the label off and rip it up so no one knows my information. Do not flush medicines down the sink or the toilet unless the prescription drug label information that accompany the medicine gave specific instructions on how to do so. Some, like fentanyl patches, are flushed with instructions. So this will depend, but most of the time, do not flush them. And why the Environmental Protection Agency has asked us not to do that, because it gets within the system. So do not flush this down. Don't do it down the commode, down the sink, or anything. We're not doing it that way. So I gave you 3 options there. Take back drug day offered in April or October, April, or you can go to a permanent drop box place located at your sheriff's office, local police office, or like a Walmart. You can check out our website to see where locations, click on the link, put in your zip code to find that, or you can do it at home with this. If you have like a bottle or something, you can do it this way. But if you have multiple, I would recommend taking it to like your police department or sheriff's office or something like that. Next. Some upcoming trainings that we have, something that we offer on a regular basis is a mental health first aid class, and that will be to be announced. Our instructor, I believe she was with you last year, and she is out on maternity leave. But just to let you know, this is an awesome class for you to participate in. What we have going on in our world now with all of these suicides, unfortunately, it's an awesome class for you to participate in if you're interested. Check out our class, our website for this. It is an excellent class for you just to know the signs, and I believe that God has given us all this information for a reason. And as I was reading in 1 Peter, to love and to sincerely love and deeply love our brothers and our sisters, this is just excellent information for us to have and stuff, and to be able to reach out to those that are in need of this information. Next. Any questions? I know I went through a lot of information and everything, so I'm trying to go back through some things that I know that I saw that about
Ava, you had a question earlier about, what about salt?
What, like not having it, or?
Yeah, like cutting it back, or
yes.
Is it okay to cook with, or?
I would cut back on it because they recommend that. They even recommend that not just with hypertension, but they recommend that even with your kidneys to cut back on it. So yes, monitor your salt. I believe it's now at 2,300 milligrams of salt that you need to have per day. So if you're talking about cooking with it, then if you're going to add it to your food, then that's a lot of salt. So you may just want to cut back on it. Try seasoning with using other seasons like Mrs. Dash and other things. I promise you, there are a lot of other things out there that you can season with without using the salt.
Also, we had two ladies that questioned, and of course, this is medical information, so you may not want to answer it particularly, but what if you've been taking blood pressure meds for years and you still have problems with your blood pressure? And the other was, after several visits to your doctor and your pressure's in the normal range, do you need to keep continuing with your blood pressure medicine?
Definitely. Let's take the second one first. That's something that you would need to talk to your primary care physician about. I would definitely mention to them that if you are taking meds and your blood pressure has been in the normal, maybe speak with them about, is there a way that you can lower, like go down? Maybe you're at a 25 milligram, is there a 10 milligram, and gradually go down and monitor your blood pressure that way. So you're going to just gradually titrate down, but I would talk with your primary care. Most of your physicians, they don't want you on medication. So just work with them, talk with them, and let them know that, I've been in a normal range. I've been on this for a while. So can we just try me like gradually working off of this? And most of them will be like, yes, sure. Let's see how we can do this. So yes, let's do that. Now, the first question, read that again.
Okay, hold on, wait a minute. Let me back up. What if you've been taking blood pressure meds for years and you still have problems with your blood pressure?
I would check to see what else is going on. Are you like monitoring what you're eating? Are you exercising? Is there anything else on your end that you may can do to aid in with the medication? Is it something, maybe do you need to lose weight? Is it something that you need to do on your end to help with that? Again, that's a discussion with your primary care physician as well. Most of them, if you have these discussions with your PCP, they will talk with you about it. They will, they don't want you, and I say most don't want you on medication. So ask them and see, how can we get this under control?
Barbara Gaither wanted to know disposal of liquid medications. Would you do that the same way as the pills? Mix
Yes.
it with dirt or something, but not pour it down the sink?
No.
Okay. And then we had Ruby Johnson was questioning, is there anything in that the legislature can do, or that we can goose our senators and legislators about to help with this? I mean, is it funding to the different areas, or what's the best way for us to do that?
I would check. I know that with the American Diabetes Association and the American Heart Association, they both have efforts that are out there as far as with legislative days that they do as well. The American Heart Association actually have a walk that's coming up this month. This is Heart Month for them. So they do actually American Diabetes Association, both of them do legislative days. So if that's something that you're wanting to get involved with, I would check out their pages and see how you can. And actually their walk, the American Heart Association, their walk is the end of this month. So you definitely can get involved with them, and they would love for you to participate with them in their legislative efforts and stuff. As far as what we're doing with opioids and stuff and moving forward with that, we are working with DHEC and moving forward with trying to get just the information out there now. We are now not at the legislative efforts of moving forward, not yet, but that's where we're at now. We're just getting the information out and working with DHEC and working with organizations like SAMHSA and things like that.
Linda Eichenbaum wanted to know, are we confident that uninsured people have access to diabetic treatment resources, and where would they get those?
I would check with through your primary care physician, their office, like the social worker. Usually they have one, that even the hospital, they have information that you can get from there. And that's a good question. And I say that because I remember my cousin who was struggling with that when she was unsure. Now that we have the insurance that's available, that hopefully they can use, even those that are uninsured, they can actually take advantage of that through that insurance. But even if they don't, yes, I would check with social worker, like at the hospital, or even through your PCP, even mentioning to them, they have resources there if you just asked. So am I confident? I would say ask, but I know that there are areas, even when I worked at the hospital, but mentioning through our diabetes educators there, they knew of places where they could get some information from.
Very good. Deborah, you've got your hand up, but I think it's been up for a while. Did you have a question?
Yes, I did. I do. I'm one of those that I'm suffering with the hypertension. It's no fault of my own. Military, took meds. It started my blood pressure to go up. Now the problem is I'm taking blood pressure medicine. The blood pressure medicine that they are giving me is not working right. And now they just told me I got to watch my sugar because I'm too sweet.
Mm.
And I am frustrated. Matter of fact, that's the reason why I was coming on this call late, because I was talking to I was on the phone with the VA about the situation. I was having a video chat.
Deborah, let's talk. I would love to talk to you offline to see exactly what you're doing, and see if we can, because this is what we did through the diabetes prevention program. So yes, let's talk, because have they actually diagnosed you with diabetes?
Oh yes, my AC1 was a 10.2.
So you were the one with the 10.2. Okay.
And
so
then they took my blood pressure on Friday, and it was 178 over 100.
Oh my goodness. Okay. Yes. Let's talk. Let's talk offline, because see, you're the one that I used to love to stay in contact with and see how we can actually work on this and see what we can do on this. Can you show the next slide? It has my information on there. There you go. And that is my email. Email me, Deborah. And I would love to see how we can, again, this is what, in my previous, when I was at, it's now Prisma, it was Palmetto Health, but now it's Prisma, it was Palmetto Health, yes. But this is what I did, and I absolutely loved it. So yes, I would like to see but I know that if managed, we can get it under control. I've seen it happen. I know it can be done. And by the grace of God and with his help, I know it can be done as well. So yes, just email me. And yes, I think that would be great. So yes.
Okay, that'll be fine. Thank you.
And yes,
thank you, Deborah.
And I would be willing to share this information again. I think you asked Azalee. I would be willing to share this again. Just let me know. So yes.
Do we have any other questions for Ava? If not, Ava, thank you so much.
Thank you.
My primary care physician is going to love you, because I actually now want to go get a blood pressure monitor and a blood, blood prick thing, because he's been telling me to do that for 4 or 5 years and I haven't done it. And you've made me scared now. I need to go do that.
Yes.
So I know he's going to love you.
Yes.
For those of you in attendance, thank you so much. Our next session will be next Tuesday on predatory lending. This should be really interesting, and we would love to have you join us. So please, again, Ava, we appreciate so much your expertise and presenting to us. And now I would like to turn this over to our prayer warrior for this morning. Vicki Harvey is our South Carolina Conference UMW Spiritual Growth Coordinator, and she will close us in prayer.
Wow, my head is spinning. I don't know about y'all's, but I really did get a lot of information this morning, and I do have both of those wonderful things that Ava was talking about. So I understand where a lot of people may be coming from. But it was such a wonderful talk, and we really do appreciate all of the information that you get. And I do appreciate you having Michael in your prayers and all that he's being deployed. So as Lori said, I am Vicki Harvey. I am your spiritual growth coordinator for our conference. As we go to God in prayer this morning, I would like for everyone to just take a deep breath. Just take a deep breath, let it out slowly, and let us center ourselves in prayer as we pray this morning. We want to thank you that you are the God of faithfulness. Even when we fail, you never let us down. As we have gathered today, we are grateful that you are in our midst. In everything we do together today, we pray our eyes would remain on you and we would listen carefully to your voice. Be with those who are suffering today. Be with those who are suffering from illness, from loneliness, and from health concerns that they may have experienced. We thank you that we can entrust our loved ones to your gracious and compassionate care. Be with our speaker, Ava, as she goes and does her work within DHAC and within the public health service, as well within your service, Lord. May her words give us all better understanding of the health faces, and that our brothers and sisters may face, so that we as United Methodist Women, dear Lord, may give aid and comfort to them. Be with us as we take this information and move forward in faith, hope, and love. May your peace, which surpasses all understanding, guide our hearts and our minds in Jesus Christ. In his name we do humbly, as your servants pray. Amen.
Thank you so much, Vicki. I appreciate that. Kathy, Linda, do you have anything else